Asthma is a chronic inflammatory disorder of the airways characterized by episodes of reversible breathing difficulties due to bronchospasm, inflammation, and airway hyperreactivity. Common symptoms include wheezing, coughing, chest tightness, and shortness of breath. Chronic obstructive pulmonary disease, COPD, a progressive lung disease that includes emphysema and chronic bronchitis. COPD is characterized by long-term breathing problems and poor airflow due to damaged lungs. Symptoms include a persistent cough, chest tightness, shortness of breath, and frequent respiratory infections. Pneumonia, an infection of the lungs caused by bacteria, viruses, or fungi, resulting in inflammation and fluid buildup in the air sacs, alveoli, of the lungs. Common symptoms include coughing, fever, chills, difficulty breathing, and chest pain. Tuberculosis, an infectious disease caused by Mycobacterium tuberculosis, which typically affects the lungs. Symptoms may include a persistent cough, fever, night sweats, weight loss, and fatigue. It can be latent or active and is contagious in its active form. Bronchitis, inflammation of the bronchi, airways, in the lungs, usually caused by a viral or bacterial infection. Symptoms include a persistent cough, mucus production, chest discomfort, and fatigue. Bronchitis can be acute, short-term, or chronic, long-lasting. Emphysema, a chronic lung condition characterized by the damage of air sacs, alveoli, in the lungs, leading to difficulty breathing. Symptoms include shortness of breath, a persistent cough, wheezing, and reduced tolerance for physical activity. Acute respiratory distress syndrome, ARDS, a severe, life-threatening condition in which the lungs are unable to provide adequate oxygen to the body due to fluid buildup in the alveoli. Common causes include pneumonia, sepsis, and traumatic injury. Symptoms include severe shortness of breath, rapid breathing, and low oxygen levels in the blood. Cystic fibrosis, an inherited disorder that affects the respiratory, digestive, and reproductive systems. The primary symptom is the production of thick, sticky mucus that clogs the airways and can lead to persistent lung infections, breathing difficulties, and other complications. Pulmonary hypertension, a condition in which high blood pressure affects the arteries of the lungs, causing the right side of the heart to work harder. Symptoms include shortness of breath, fatigue, dizziness, and chest pain. Pulmonary hypertension can be idiopathic or associated with underlying heart or lung conditions. Idiopathic pulmonary fibrosis, IPF, a chronic and progressive lung disease characterized by the formation of scar tissue in the lungs, which thickens and stiffens the tissue, making it difficult for the lungs to function properly. Symptoms include shortness of breath, chronic cough, fatigue, and reduced exercise tolerance. Pulmonary embolism, a blockage in one or more pulmonary arteries in the lungs, typically caused by a blood clot that has traveled from another part of the body. Symptoms include sudden shortness of breath, chest pain, cough, and rapid heart rate. Pulmonary embolism can be life-threatening and requires immediate medical attention. Lung cancer, a form of cancer that begins in the cells of the lungs. There are two main types: small cell lung cancer and non-small cell lung cancer. Symptoms may include a persistent cough, chest pain, shortness of breath, and weight loss. Early detection and treatment are crucial for improving outcomes. Sarcoidosis, an inflammatory disease that affects multiple organs, primarily the lungs. It is characterized by the formation of granulomas, small clumps of inflammatory cells, in the affected organs. Symptoms may include cough, shortness of breath, fatigue, and fever. In some cases, sarcoidosis may be asymptomatic or resolve on its own. Pleural effusion, a buildup of excess fluid between the layers of the pleura, the membrane that lines the lungs and the chest cavity. Common causes include heart failure, pneumonia, and lung cancer. Symptoms include chest pain, cough, and shortness of breath. Treatment may involve draining the fluid. Pneumothorax, a collapsed lung due to air leaking into the space between the lungs and the chest wall. Symptoms include sudden and sharp chest pain, shortness of breath, and rapid heart rate. Pneumothorax can be spontaneous, traumatic, or iatrogenic, caused by a medical procedure. Influenza, a highly contagious viral infection that affects the respiratory system, commonly known as the flu. Symptoms include fever, chills, cough, sore throat, runny nose, body aches, and fatigue. Influenza can be prevented through vaccination and can be treated with antiviral medications. Respiratory syncytial virus, RSV, infection. A common viral infection that affects the lungs and respiratory tract. RSV can cause mild, cold-like symptoms in adults but can lead to severe respiratory illness in infants and older adults. Symptoms include cough, congestion, runny nose, fever, and wheezing. Rhinitis, inflammation of the nasal passages, also known as a stuffy nose or runny nose. Rhinitis can be caused by allergies, infections, or environmental irritants. Common symptoms include congestion, sneezing, postnasal drip, and itchy eyes. Sinusitis, inflammation of the sinuses, usually caused by a viral or bacterial infection. Symptoms include facial pain and pressure, nasal congestion, headache, and thick nasal discharge. Sinusitis can be acute, short-term, or chronic, lasting more than 12 weeks. Pharyngitis, inflammation of the pharynx, commonly known as a sore throat. Pharyngitis can be caused by a viral or bacterial infection, such as strep throat. Symptoms include throat pain, difficulty swallowing, swollen lymph nodes, and fever. Laryngitis, inflammation of the larynx, or voice box, often caused by a viral infection, overuse of the voice, or exposure to irritants. Symptoms include hoarseness, loss of voice, and a sore throat. Laryngitis is usually temporary and resolves on its own. Croup, a viral infection that causes inflammation of the upper airway, most commonly affecting young children. Croup is characterized by a distinctive barking cough, hoarseness, and difficulty breathing. It typically resolves within a few days with supportive care. Epiglottitis, a potentially life-threatening inflammation of the epiglottis, the flap of tissue that covers the trachea. Epiglottitis can lead to airway obstruction and difficulty breathing. Symptoms include a sore throat, fever, difficulty swallowing, and drooling. It requires immediate medical attention. Laryngotracheobronchitis, inflammation of the larynx, trachea, and bronchi, also known as croup. It is most commonly caused by a viral infection and results in symptoms such as a barking cough, hoarseness, and difficulty breathing. Treatment typically involves supportive care. Tracheitis, inflammation of the trachea, or windpipe, often caused by a viral or bacterial infection. Symptoms include cough, sore throat, difficulty breathing, and chest pain. Tracheitis can be acute or chronic and may require medical treatment if it does not resolve on its own. Bronchiectasis, a chronic condition characterized by irreversible damage to the airways, bronchi, causing them to become abnormally widened and prone to infection. Symptoms include a persistent cough with mucus production, frequent respiratory infections, shortness of breath, and wheezing. Asbestosis, a chronic lung disease caused by prolonged exposure to asbestos fibers, leading to lung scarring and inflammation. Symptoms include shortness of breath, cough, chest pain, and finger clubbing. Asbestosis can increase the risk of developing lung cancer. Silicosis, a lung disease caused by inhaling crystalline silica dust, resulting in inflammation and scarring of the lung tissue. Symptoms include cough, shortness of breath, fatigue, and chest pain. Silicosis can be acute, chronic, or accelerated, and there is no cure, but symptoms can be managed. Pertussis, which is known as whooping cough, a highly contagious bacterial infection of the respiratory tract, characterized by severe coughing spells that end in a high-pitched whoop sound. Symptoms include a runny nose, low-grade fever, and a mild cough that progresses to violent coughing episodes. Vaccination can help prevent pertussis. Diphtheria, an infectious disease caused by the bacterium Conbacterium diphtheria, affecting the mucous membranes of the respiratory tract. Symptoms include sore throat, fever, swollen glands, and difficulty breathing. A characteristic feature is the formation of a grayish membrane in the throat. Vaccination can prevent diphtheria.